tired of hearing people say that it's dangerous. It's not dangerous. Someone says, I'm just going to take your implant out. Having known what I just told you about the publication that came out and what the other publication shows about oxylipin, does that make a lot of sense? Because the biofilm is not going to come out with the implant. When we send samples out, we don't send implant samples. We send your scar tissue sample. So if you leave the scar tissue in, but took the implant out, then the biofilm or the bacterial colonization is still going to be there.
Right.
So for everybody listening, if you don't take out the capsule that has the bacterial contamination on it, you're really not solving the sense.
You're explanting, but you're not cleaning and taking everything that it caused and to grow or whatever. So when you're so you need to go to someone that's experienced and you need to ask that, like, make sure that that's.
Let's qualify the problem.
And like I said, everybody listening, if you know anybody having any type of surgery, boob or not, everybody needs to read this book. And you lay it out for us so that we are empowered to prep and recover and detox and, really get to the root and remove it.
So I make a video about them to try to explain them in layman's terms, what is being said in the paper and how does it impact the patients so that they can understand it. And when they go into their surgeons, there shouldn't be this kind of back and forth. The patients and the surgeons can read and they can have a communication about expectations. So the surgeons are going to be slow adopters, but you women and everybody listening can take control of your own destiny by getting the book and reading the book, because I wrote it so everybody can understand it. It is not a complicated book. You can take more control of the situation for yourself and advocate for yourself. Yeah.
And that's like when you have this information that's empowering you and you can become your own advocate, you just have more awareness when you're interviewing a surgeon to know if they're on your wavelength or not, because you're asking questions guided by this. And if they're standoffish or don't have time or not even open to having that conversation, find another surgeon. Like my guy